Well, hi everyone. Welcome to this special edition of Daytime Columbus featuring Licking Memorial Health Systems. I'm Robin Haynes, along with their president and CEO, Rob Montague, who joins me as co-host once again.
Well, I'm really happy to be here once again. We're going to shed some light on issues that impact millions of Americans. It's increasing every day. That's diabetes.
Yeah, so we are going to begin our show, Rob, with a discussion on what causes diabetes and its specific impact in the Licking County area. Then highlighting their medication therapy clinic. That's another resource aimed at educating patients. Plus, Audrey shares more about their wound clinic. It's a place that sees firsthand how diabetes can impact your quality of life. And we end with 5 fast facts about how Licking Memorial Health Systems really puts diabetes care at the forefront. That is all ahead on today's Daytime Columbus. All right, at this very moment, more than 30 million people in the U.S. have diabetes, and 1 in 4 of them don't have any idea they have it.
The statistics are clearly staggering, and because of its prevalence, Licking Memorial Hospital, the health systems, we're committed to preventing it, helping them manage it, and if possible, maybe turning it around.
Yeah, and Rob, joining us for a deeper dive into diabetes care, we have Dr. Marco DeSantis. He's an endocrinologist with Licking Memorial Health Systems. So thanks for being here and shedding some light on this for us.
My pleasure.
All right, Doctor, I do want to start with Rob first because we like to kind of take a look, Rob, at the statistics for Licking County and talking about just how big of an impact it has, how extensive it is. And there's one particular group that you say is more at risk, right?
Yeah, in Licking County, about 1 in 10, so 10% will experience diabetes, and as you get older, it's more prevalent and more likely. So unfortunately, as all of us start to get older, certain things happen more often, and diabetes crops up in folks as they age.
Yeah, it's unfortunate. It's something, why we're here to tackle it, of course. And then now we're going to go to, obviously, the medical professional in all of this,
so
right?
Talk about diabetes and how an individual maybe develops it.
So, there's 2 distinctions for the most part. There's type 1 diabetes and type 2 diabetes, but the majority of people have type 2 diabetes. And type 2 diabetes is really a disease of lifestyle. And so the good news about that is that it can actually be turned around with lifestyle changes, diet and exercise and other things.
Now, we know, too, as we talk about these 2 types, that there are people who don't even know they are diabetic. What are some signs people should look for? And we know we hear the term kind of pre-diabetic. Is that a time to take action?
Yeah, there are different symptoms that can happen. The symptoms are more precipitous for people that develop type 1 diabetes. It happens much more quickly. They may experience, excessive thirst, excessive urination, weight loss. Those symptoms don't happen as dramatically in type 2 diabetics. A lot of times, people that develop type 2 diabetes, it's caught early based on blood work at their doctor's office, or they happen to have a high blood sugar that's randomly checked.
Okay.
And then so it's found that way, typically.
So other than lifestyle change, what are some other treatment options, or is lifestyle change really the best treatment option when you start seeing patients?
So for type 2 diabetes, I think lifestyle changes, those are the hallmarks of really the treatment. But for type 1 diabetics, primarily it's insulin therapy because the pancreas doesn't make insulin because it has undergone an autoimmune attack. And so insulin therapy is really the main treatment. For type 2 diabetics, there's a whole host of different therapies. There are oral therapies and many different injectable therapies. And some type 2 diabetics eventually do need insulin. But for the type 2 diabetics, I would say diet therapy is very, very important.
And I was just thinking, you're an endocrinologist. A lot of times people don't start at a specialist level. We hear all the time kind of know your numbers. Is that something that we need to just, being proactive as a patient, be concerned about?
Yeah, as a general rule, a fasting blood sugar over 100 is, cause for concern that you have maybe prediabetes. And the other measure is a hemoglobin A1C, which is basically a 3-month blood sugar average. And that number really should be under 5.7%, meaning that you would not have prediabetes. Above 6.5% indicates diabetes.
Okay, so that's when you probably want to go further, go to an endocrinologist who knows all of the options you have in treatment.
Exactly.
Okay.
Yep.
And I think you're right on. Your primary care physician should be of great help as you try and evaluate whether or not you are getting into that danger zone.
Yeah,
Right.
and you guys have a lot of resources. What else do you do if somebody comes to you and is diagnosed? You have a lot of resources to kind of send them to and be able to help.
Yeah, we have dietitians, we have an insulin clinic or a medication therapy clinic, And we have a lot of knowledgeable people who are trained in pump therapy and all sorts of different things. So whatever anybody needs in terms of diabetes care, we offer that at Licking. So.
Okay, the first step though, as we mentioned, is getting in, knowing your numbers, seeing if there is a problem, and then of course taking it from there, being proactive. So you can contact Licking Memorial Health System at the website, obviously give them a call and kind of start at the ground floor and work your way up, because we want to help some people around.
Absolutely, that's why we're here.
All right, as with most chronic conditions, medication does play a key role in diabetes as well. So up next, how Licking Memorial Health Systems goes the extra step to make sure patients are confident when managing their meds.
We're also going to look at the risks when someone who is diabetic becomes wounded, whether that's through surgery or an injury. Recovery takes extra care, and we are there every step of the way.
Well, as we continue to shed a light on the increasing health concern that is diabetes, it's also important to get into some of the resources they provide at Licking Memorial Health Systems in regards to treating it.
The number of adults diagnosed with diabetes has more than doubled just in the last 20 years. And we know that education is really the key when it comes to a treatment plan. And to that end, I'm happy to welcome LMH Director of Pharmacy, Jean Glazer, and she's going to talk about the Medication Therapy Clinic. So Jean, starting off, what is the purpose of the Medication Therapy Clinic?
I'm going to go back and give just a slight bit of history. So back in 2003, we were focused on some things that the ISMP was bringing out, that's the Institute of Safe Medication Practices, as well as Joint Commission and some of the things they were really looking at heavily. And at that time, we were looking at anticoagulants and some of the concerns. So pharmacists began to see where if we look at chronic diseases that are heavily dependent upon drug therapy, and we have what ISMP would consider to be a high alert med, that we needed to be more involved to help those patients. And part of that would be to help keep them from having adverse drug events that would be caused from that. So that's kind of where diabetes comes into play, because insulin as well as anticoagulants are known as a high alert drug. So we started in 2003, focused on anticoagulants, and then as things started gearing up, I know Dr. DeSantis and I was having a conversation about just the number of new anti-diabetic meds that have come out since the last 10 to 12 years, and how some ways that we can help our physicians, our local physicians. Many of us have went to school prior to the time many of these new meds have come out. So we find the clinic was a source and way to really focus on quality issues, focus on ways to prevent adverse drug events, and more able to educate patients. And that's what we found. Unlike maybe a physician visit where you have a limited scope of time in front of that physician, we have multiple disciplinaries that work there and able to expand the time that those patients spend, and hence better educate the patient.
And it really is about that. And we mentioned just with Dr. DeSantis about, type 1, type 2. Are the treatments different? Do you face different things with them as far as, the medications that they're on and what you have to do in order to keep things kind of seamlessly?
Yes. Now what we do in the clinic is we focus on insulins, and that's probably where the biggest changes come. I think we were thinking back through the last 50 years, there was a period of time where you just didn't have hardly any changes with insulin therapy. And now it's kind of imploded, and we have a lot of other meds that help increase or enhance the ability of insulin to work in the body. So back to the type 2, yes, their pancreas is still working. They still have some functionality insulin being produced. So we've come up with other tools now, other drugs that can enhance our own body's insulin to work more effectively. And it's a balance that needs to be dealt with delicately, and we just are a part of helping to adjust that and make that happen a little bit better.
Yeah, it's interesting.
So clearly pharmacists are an important part of the team, but there are a multiple group of employees that work in the clinic. So maybe talk about the different folks that patients can expect to see.
Sure. What I thought I'd do is run us through what a patient visit looks like, and then we can see each of the scopes and who helps with that. So initially when they come, they get to visit for maybe 10 or 12 minutes there with a nurse. And she, of course, would collect their vital signs. She does a blood sugar and is able to spend time, ask them questions, how you've been doing. She likes to make sure that they're rotating the sites of their injections for their insulin. As she's going through her workup, they're getting more comfortable and being able to identify questions and answer some things that would be helpful for the pharmacist that comes in a little bit later. So that assessment's key and gets the patient comfortable and able to really help answer things.
And then so from the nurse, they move on to?
So while they're visiting with a nurse, the pharmacist is busy over here behind the scenes looking at their logs that they brought in, and or perhaps if they happen to wear a continuous glucose monitor, they're looking at their trends of what their blood sugars have been doing, or they're just looking at the meter that they brought. So we have different tools. They're looking and seeing if there's highs and lows going on, is there any trends going on, so that they're preparing to go in and then in more detail talk with the patient.
All right, I want to talk about the success rate of the clinic. Where do you see this working for them?
Well, we've been able to certainly identify, as I mentioned, these high alert drugs. They tend to end up causing patients to end up in the ER or maybe even a hospital admission more so than other non-high alert drugs. So we've found that I think statistics show that some 700,000 ED visits a year are attributed to adverse drug events.
Wow.
And about 100,000 admissions a year. So what we do is we watch that. We found the more we educate patients, the better they understand their drug therapy, what to look for, how things work, the better able they can care for themselves and able to know when to call a physician, call a clinic, and get better information.
Absolutely. All right, Jean, it is all about kind of that education, getting a correct treatment plan. So thank you so much for sharing that with us.
Yes, thank you. Great.
From the inside out, up next, another aspect of diabetes management, helping care for chronic or complex wounds. We're learning more right after the break.
And later, from a summer camp for young kids with diabetes to a dining program for all, I'll share even more ways Licking Memorial Health Systems is dealing with diabetes.
When it comes to having diabetes, one of the major impacts on your body is its inability to heal, and that obviously can quickly become a serious health concern.
So Licking Memorial Health Systems Wound Clinic offers complete and cost-effective care. Audrey Hassan and I had a chance to sit down with one of our professionals and a patient, and they're going to explain just how important this aspect of care truly is.
We are here at Licking Memorial Hospital's Wound Clinic as we continue our discussion on diabetes. I'm joined once again by President and CEO Rob Montague, as well as Director of Surgical Services here at the Wound Clinic, Angela Wallace, and patient Sue Whelan. Thanks so much for joining us.
Great to have you out here.
Angela, let's start with you. As the director here at the Wound Clinic, talk to us a little bit about the importance and overall goal of the Wound Clinic.
Well, the Wound Clinic plays a critical role in wound care management for our patients, specifically with patients with diabetes. The Wound Clinic can help in providing information and support also for the prevention of future wound formation for those patients as well.
Angela, you mentioned diabetes, and that would be one condition. Are there other illnesses, conditions that you tend to see that come through the Wound Clinic for folks who receive services at Licking Memorial?
Yes, absolutely. We see a variety of different patients. Diabetes plays an important role in the Wound Clinic, but certainly we see patients with vascular conditions, with wounds that have had difficulty healing after surgery, all different types of wounds.
And Sue, let's get into a little bit about your story. How has the Wound Clinic here helped in benefiting your diabetes management?
Well, of course, if the patient has to take their advice, but they always stress protein, protein, protein because they want our wounds to heal. And I will say, I will give Dr. Cheeto, her office staff, the nursing staff here, credit for me having 2 feet.
Mm-hmm.
That is so wonderful.
Well, it's great that we're able to help Sue because she has helped us for so many years as a volunteer. So to make sure that we take good care of you helps us also because you're helping us as a volunteer. So if you're looking for a New Year's resolution, you want to give of your time to a community organization, certainly I'm sure we're not the only hospital that benefits greatly from volunteers. You may think about that in this new year.
Sure. Absolutely.
And Angela, let's go back to a little bit of the services that you provide here at the Wound Clinic, a little bit more in detail for diabetes management patients.
Yes, certainly. We have a diverse group of healthcare professionals that include podiatry, surgeons, nursing, as well as patient technologists. We offer referrals also to endocrinology, to nutritional services. These experts help determine the very best possible care for our patients with diabetes using the most advanced technologies such as biological dressings. Those are like skin grafts, also skin substitutes as well. They also help with nutritional support, with infection prevention management strategies, surgical interventions when necessary, a variety of different services that we offer.
So Rob, where can viewers go for more information on the Wound Clinic and other services?
Our website has all kinds of information about services, programs, physicians. So go to our website, www.lmhealth.org, and all the information is available.
Thank you all so much.
Thank you.
Thank you.
Thank you very much.
All right, lots of good info there. And after the break, we're going to run down 5 additional facts with Rob here that show that the true commitment Licking Memorial Health Systems has to the community they serve. So stick around. All right, happy to be back now with Rob Montague. He's the president and CEO of Licking Memorial Health Systems. We've got 5 more facts about the programs and systems in place to help the community cope with and truly fight against diabetes. So,
yes.
Rob, this is when we get into some of the nitty-gritty stuff that we didn't share, and you have so many resources that we'd like to share about. So I want you to talk about the way you help people self-manage their care, and you have something called the Diabetes Learning Center.
Yes, no question. Education, you've heard that theme throughout a lot of the discussion this morning, and making sure we have our clinical folks available for them, dietitians, nurses, whoever, pharmacists, to help educate them and let them learn about the disease and let them manage it is critically important to their success.
Yeah, it's absolutely great too to not have it in really kind of, you have it in this simple environment where people
Yes.
can come in and feel like they're not, you know, tied down in learning about something. It's really neat. So you also have this partnership in diabetes care through Ohio State University's Extension Office.
Yes, dining with diabetes. And once again, we heard Dr. DeSantis talk about lifestyle, and in particular, the dietary habits can really impact this. So dining with diabetes is a great opportunity to educate them about their diet and even give them some tips on recipes and ways to cook food to better handle their diabetic state.
And food and exercise typically go hand
Yes.
in hand. Your wellness centers are a great resource.
We want to make sure folks have an opportunity to exercise even if it's cold and rainy. Certainly in the summertime there are plenty of outdoor spots, but so we have wellness centers throughout Licking County, 2 significant ones over at our high school vocational center over at CTEC, is what we call it, and at 1717 West Main, just up the road from the hospital, we have a very large wellness center.
I was going to say, I visited the one on one of the ones on the main campus area, I think, and they are just a great place too. People were just having kind of social time, able to sit on the bike and kind of just enjoy working out.
Yeah, there is a social aspect, which is, I think, very important, especially for folks as they get a little bit older.
Helping kids understand their diabetes care can seem a bit tougher. You make it fun. You've got a camp, A1C?
Yes, Camp A1C is one of our camps that we offer to children in the Licking County community, and it once again is a fun opportunity, but it's an opportunity for us to educate them about diabetes. It's great for them to meet other kids that are maybe experiencing some of the same challenges that they are, and you can just see with the picture there a lot of smiles and a lot of fun.
And similar camp activities that maybe their friends that don't have diabetes will get to experience.
Yes, and we've seen all kinds of connections where play dates are made with families and parents, and it really builds some bonds between the families and the kids.
Yeah, and to not feel self-conscious if they maybe have an insulin pump or something that in school may be providing a barrier for them.
Absolutely.
All right, that's cool to see. And part of your open book policy, Rob, you guys actually publish a yearly diabetes report card.
Yeah, I think it's very important for us in this day and age to be transparent in a positive way. And we have published information about our performance for many years, and one of the specific report cards we've had for many years is diabetes. And so folks can go on our website and look up our diabetes report card for many years back.
and see how you compare to other places. I do appreciate that. I think everybody should in their hospital system when you can be transparent and have people trust in you and what you're providing. So again, Rob, I just cannot thank you and your team. You always provide us with an education and guidance, of course, today on a topic that so many people are impacted by in diabetes care. So thank you.
It's great to be here. Any way we can help keep Licking County well, we're there for them.
All right, we want to let people know too, a quick note that all the segments will be posted on our website. It's nbc4i.com/daytime. And of course, stick around. It's only 12:30. We got half hour more of Daytime Columbus coming your way. Thanks again, Rob.
Thank you.